thank you all for being here. This is a tremendous day for us in Richland County and in the Midlands. We're joined here with our law enforcement partners at Richland County Sheriff's Department. Sheriff Lott is, we're proud to host him here today. Appreciate him making time to come out. This is something that's come out of a partnership that started a few months ago. We are MUSC Health, and we're here to take care of patients in the community. Sheriff Lott and his team are also here to support our community members. Sheriff Lott came out. We were excited to celebrate a ribbon cutting and an OB launch at our Northeast Hospital, and he's been there to support us, and this was a great opportunity for us to show reciprocal support back to him and his team and all that they're doing to keep us safe in our community. So we look at them as partners. Our job is to take care of people. His job is to protect people, and it's a way for us to just reciprocate and band together and make sure that we're doing everything we can to support our community here in the Midlands. So we're proud to be here today with the Sheriff's Department. Hopefully this will do some good for them and their officers out in the field. We appreciate all that they do every day. And with that, I'm going to let Sheriff Lott make some comments.
It still haunts me that in December of 2007, I had a Richland County deputy named Darrell Lane who was in a car chase and was in a fight with two suspects and had a heart attack, and he died. Our deputies got there, and they did not have the equipment they needed to maybe save his life. This equipment right here, an A.E.D. It's a simple little machine, doesn't look very big at all, but it's a life-saving piece of equipment. Matt and I talked about it, and they asked what could we do to help the community out, and I said, we need some more of these. And so he said, we're going to make it happen. And so today, they're donating 14 of them to the Richland County Sheriff's Department. We have 7 patrol regions throughout the county. 2 of these will be out in each region 24/7. So we'll have them. We'll have the availability of them very quickly. We saw how valuable they are when the state fair was here a couple years ago, and we had an individual on the fairgrounds who had a heart attack. Our deputies were the closest one there. They were there within a minute with this machine right here and was able to save the man's life. It took EMS 13 minutes to get there. Now that's typical because EMS is so overworked. Our deputies are at these emergencies very quickly. So now we have the equipment. Thanks to you, MUSC Health, for being a great community partner. This hospital is not just about serving people within these walls here. It's about serving the community. And this is a great example, and just one example of what they do. They do so many things that people don't know that supports the community as a community partner. This is one of them, though, we thought that the public needed to know about because it could save somebody's life out in our Richland County community. So we're honored and we're proud for you to stand up tall and give us these devices to put out in the community. They're going to work. I hope we never have to use one, but I think we all know that heart attacks happen. They happen every day. I wish we could do more to prevent them, but when one happens, then we need to be able to address that victim and be able to do it very quickly to save their lives. This will do it right here. So on behalf of Richland County Sheriff's Department, but also the citizens of Richland County, thank you. And USC Health to stand up tall and do something great for the community. So thank you very much.
Thank you. Appreciate it, Sheriff.
Questions?
Can you talk a little bit about the training that goes into that?
Fortunately for us, it doesn't take a whole lot of training to do it. It's pretty much self-explanatory. Anybody can do it, but our training division has people that are trained, and so all of our deputies are trained in how to use this piece of equipment. So we do the training in-house, so that's not an issue. It's just having enough of these devices to be able to have them out in the community. And now with 14 more that we've added to what we already had, that's going to help us out tremendously.
Are you going to be the first law enforcement agency to have this equipment?
I doubt that. I think that we are the largest law enforcement agency in the state. And so our deputies are out there all the time. So we already have some of these devices, but we needed more. And that's what the conversation I had with Matt was with that. We needed more. We needed to get more out in the street. So these will not be in a building, not in any facility. They're going to be in a patrol car out in the community where we respond very quickly. So this is going to help us out to save lives.
And cost-wise, in a ballpark, what is something like that? I know it's costly.
This is about $25,000 worth right here. So these 14 devices, that's $25,000 that MUSC Health has found and said, look, it's important enough to put these devices out in the community to save someone's life. So, you know, that means a lot, not just to me, but I think to all the citizens of Richland County that, you know, this hospital and what it stands for is about saving people's lives, and these devices will do that.